Hi, this is Tom, the gas station guy from Delaware again. My topic today is the healthcare crisis in our country and how to fix it. First, the healthcare crisis. I think we both agree the numbers of uninsured in the U.S. is smoke and mirrors, to say the least. I know of no one who has gone door to door and counted all the people without insurance. And of course, the Democrats count the illegal aliens in that number, which is an immigration problem, not a health care. In any event, here's my solution. The infrastructure for health care for all Americans is already in place and is being overseen by 50 state insurance commissioners. I don't know how many insurance companies offer health care plans, but I'm sure the number's great. Also, Blue Cross and Blue Shield, in my opinion, is the most competitive of them all. My insurance commissioner puts out a booklet every year comparing insurance company rates and ratings for all types of insurance each year. Here's what I think needs to be done to cover all Americans. Just as each state requires a person to buy auto insurance in order to drive a car in their state, I think the federal government would issue or enact or pass a law, whatever it takes, to first level the playing field by applying the standards of group coverage to everyone. Then setting an age limit of, an example, age 21, when a person must buy health care insurance. There are several exceptions to this: students, disabled, etc. The least able to pay among us are already receiving Social Security benefits, food stamps, etc., so would have no cost for their insurance. They're already getting Medicare insurance. The rest of the uninsured are people who either prefer not to buy insurance. When you're 21, you expect to live a healthy life forever and never get sick. The cost for a single person who has no insurance is prohibitive today, and I will explain that to you in a minute. There are people in the in-between income levels. A determined amount with a determined amount of children could apply for state assistance for a credit to the purchase price of the insurance. And of course, there are people who can just not afford the present single-person family cost of health care insurance. The federal government could offer monetary help to states, first to increase the need in staff to review concerns and additional paperwork for credits and waivers, and also to reimburse the states for credits being offered to citizens of various states. Although I feel the insurance companies would see such a tremendous increase in income, with perhaps a percentage of that increase which could then be allocated to the states in which they are doing business. As is now done with homeowners' fire insurance coverage, a percentage of that is given to the states to be distributed to the fire companies within the states, although a lot of people don't know about that either. The insurance companies in Blue Cross would either, on their own, or, which I expect with government mandate, offer a menu of coverages with various deductibles. A 21-year-old could pick a policy with a high deductible and lower cost, and as they became older, they could lower the deductibles when the policies come due on a 6-month or annual basis, just like all other insurances, homeowners and auto, etc. The reason health care is so expensive in this country has many reasons. The illegals getting free health care, the increased cost of the equipment used to diagnose conditions, because the biggest reason is malpractice insurance, and the trial lawyers who line their pockets at the expense of the doctors and the hospitals who offer all this advanced surgery and equipment and so on. My ex-wife is a dental hygienist. 5 years ago, she told me the cost of malpractice insurance her firm paid for her was $6,000 a year, just for someone who cleans your teeth. Also, Insurance companies do not always cross state lines. The government needs to enact something to eliminate this limitation. Dealing with the lobbyists and the trial lawyers is a problem that we all face on all manner of things, from the cost of buying a TV set, the possibility of something hurting someone. Those costs are built into the things that we buy. The companies cover themselves because if there's a product that's any type of possibility of hurting someone, they have to prepare to pay legal fees to fight for themselves. I don't know if we'll ever get that accomplished. But anyhow, in addition to the cost of insurance, the reason it's high is that individual premiums coming into insurance companies is like a swimming pool. The more people in the pool, the more the cost is spread among everyone. That's why, for instance, a company like DuPont Company can get a good rate per employee because the range in ages of the employees is between 20 years old to 60 years old, thereby spreading the exposure among a wide range of people. Just a fact of life. But if the entire population of the United States of America is in the swimming pool, there's no way rates would not fall like a stone. But as I said, the federal government has to play a supervisory role, not a provider role. The government tends to screw things up rather than help. Just use the analogy of the Lyndon Johnson Great Society. The unintended consequences has brought us to the entitlement state we are in today and has cost trillions of dollars, and things are getting worse, not better. Nothing is really free. Someone like you or me will wind up paying for it in the end. Now, to continue further, in case the letter wasn't a coherent statement, a single person going in for insurance is rated based on their age, their current medical condition, and several other things. When a big company goes to Blue Cross Blue Shield, they say, how many employees do you have? And if they say we have 10,000, they're going to give them just a flat rate, and they don't care if somebody has an existing condition or if they're a smoker or a non-smoker, if they're overweight or they're underweight or whatever the case may be. That is the swimming pool I'm talking about. The single guy, single family, doesn't have a chance. You're going to be rated on your age, your conditions. They're going to take your weight. They're going to check the color of your hair. They're going to check the color of your eyes and any other reason, because they know they're on the hook for you if anything happens. This cross-state policy, we've seen what's happened with the Medicare prescription plan. I called and complained to my state insurance commissioner when I saw that there were 55 companies in Delaware, and each of them had a different monthly premium. Well, the fact is that the Medicare prescription plan is just like Medicare. There's a deductible, then the government pays a percentage. After a certain point, you pay it all. At a catastrophic point, the government pays 95%, period. The insurance companies had to find a way to make money. So what they did was raise premiums. They added little clauses such as preferred medications and non-preferred. They've added 3 extra classes of medicine. And when I called my insurance commissioner, I was told it's a federal program. We can't do anything about it, but we're sure getting a lot of phone calls. So once again, I say, do your homework, do some studying, find out what's available, make your voices heard. Give some thought to what I've said. I hope if I have been able to help some people. Thank you, and once again, may God bless America.